everyone. Welcome to DE Business Lab. I'm Dr. Pam Maragliano Muniz, Chief Editor for Dental Economics Magazine. With me, by popular demand, is Kandra Sellers, the founder and CEO of Tips Medical Billing. Kandra, thank you so much for your time today.
Absolutely. Thank you for having me again.
Thank you. So, okay, here we are. It's still kind of the beginning of the year, and we're goal setting, and hopefully the goals that we set in January are still on our radar as we head forward into the year. Let's talk about some goals that practices might consider implementing into their practice, and how do they move forward with it. So one goal that would really help increase our bottom line would be bringing in medical billing. So how do you feel about that as part of a goal?
Well, I think that's an amazing goal. I think we have to really start shifting our mindset into more of a medical model. I know a lot of people are really down on dental reimbursement right now because obviously those rates have went down, and we're not making headway with dental benefits. We really need to get our head wrapped around that. It's a supplemental insurance plan. It's not even an insurance plan. It's a benefit plan. It's a coupon plan, whatever you want to call it, with your patients. But it's not a true medical policy that has the patient's best interest at heart by any means. There's a lot of limitations, exclusions, and restrictions. So I think it's starting to just wrap our heads around that there is something different. We are the only medical specialty that has two places to get reimbursement from, medical and dental. And we need to tap into that. And, obviously the dental fee schedules, half the stuff on there are not even a covered expense for the patient. So, at the beginning of the year, we get new fee schedules, and I've been really evaluating dental versus medical fee schedules because I get asked that a lot. And what I'm seeing is often the dental fee schedule doesn't even, it has a fee next to the procedure. However, that procedure is a non-covered benefit for the patient. So that's out of pocket for the patient. The other thing that I'm seeing is that anywhere between 2 and 12% higher reimbursement on the medical side for the same exact procedure. So, it doesn't make any sense to me why we work so hard to obtain benefits for the patient on the dental side when it's limited to, $1,000, $1,500. Where on the medical side, we don't have those limitations, exclusions, and restrictions. It's based on medical necessity and the need for the patient. So it's a very different mindset. And that's what I really want to get the point across. Like, we have to shift our mind into something a little different if we're going to be successful and profitable in our practices in 2023. In that being, not only looking at our fees, but not allowing dental to dictate those fees. Because I have a client right now that I've been working with them for a month, and they started seeing reimbursements right off the bat. And, ended up with, close to $10,000 in reimbursements for just a few claims. Another client of mine, one claim, they got $16,000 paid on grafting and IV sedation with one claim. You're not going to see that with a dental claim. You're going to have to do a lot of dentistry to get that kind of reimbursement. So, what they start to look at very quickly is, if this is being allowed, if I'm billing this much and it's being allowed at 100%, my fees are too low for medical. So why wouldn't we shift our fee schedule to match more of a medical model versus a dental model and get paid truly as a medical specialty? It just, that makes more sense to me. I think we've just allowed dental to dictate the fees that we charge based on the fee schedules they give us.
I would also say that I think, as a dental practice owner and having worked in multiple practices, we do what we know, and we do what is most comfortable. So this is a mindset shift, but potentially has a huge reward. Can you explain kind of the differences between medical billing and dental billing? Because it's not the same, the codes aren't the same. And how do we, kind of understand what's one versus the other?
That just takes coaching and training. But what I know is dentists are very smart. Hygienists are very smart. Dental team members are very smart. It's not that hard to learn. There is a different code set called CPT, and those are medical codes versus CDT for dental. The biggest difference is understanding diagnosis codes that go along with those procedure codes. You know, and what I do and with implementation of practices, I mean, that we go through all of that and we get a very good understanding pretty quickly of what those codes are and how they pair with the procedure code. Because in dentistry, we don't have to use a diagnosis code to submit a claim, which again, the longer I do this, I think I find that really crazy. But I often get asked, you know, I get comments, I should say, you know, dental just keeps asking us for more and more. But you know, I practices ask often, you know, or comment often on how much documentation is being required for dental claims. Well, if we use diagnosis codes, which there is a spot on the claim form for a diagnostic code, maybe they wouldn't ask. They're simply asking because they don't know why you're doing what you're doing. So a diagnosis code describes the reason for the procedure. So that's one of the biggest gaps. But nothing that's hard to learn or hard to incorporate for dentists. It's really not. It's just different. It's different. But clearly the profitability is significantly higher if you allow it to be, whether it be in case acceptance because patients can't afford these procedures that are not covered by dental. The patient also has a limited mindset about the cost because they only have $1,000 max for the year, where we lose that in dental or in medical. So case acceptance. And for the patients that are paying for these services out of pocket, why not try to get them what they deserve? And that's the benefit of their medical reimbursement, right? So it makes sense. It makes sense. We're getting more and more requests from dental. Send us the EOB from medical first for, you know, wisdom teeth, frenectomies, TMJ. They're pushing it. So, and unfortunately, dental practices don't know how to submit a medical claim. So it's coming, and it's you know, it's a work in progress, but we're going to get more and more of that. And it's time to start shifting. And there's nothing I love more than seeing a dental professional getting paid as a medical specialty, because that's really what you are. I mean, we're doing surgery every day, all day in our practices, and our reimbursements are low and our overhead is high. So it's just, we need to shift. We need to shift into something more profitable.
I agree with that. So as a practice wants to implement medical billing into their practice, what could they expect for this process?
As far as how we do it, or
how do you get going, and you know, what kind of outcomes could a practice? So I would imagine that, you know, it takes a minute to decide that you're going to bring this into your practice. And
Sure.
so I think that maybe we're looking at our reports, looking at our profitability, seeing if there's places where we could become more profitable. Then if we're thinking, okay, if I'm going to bring in medical billing, what could I expect, you know, when I'm filing my taxes in 2024 for 2023?
Mm-hmm. I would love to see nothing more than a 10 to 20% increase in profitability in collections. And some of that's based on, you know, are you willing to look at increasing your fees? Obviously, some of my practices are not afraid to charge, which is great because we know that our medical doctors would charge. If we stop giving away things and we actually have a way to submit to a patient's benefit via medical, we're going to see that that collection go up, that profitability go up for sure. So we can't be afraid of that. We have to look at doing things different, and that takes time, and that's okay. I think, you know, again, when I start working with practices and they start immediately seeing EOBs come in, and I start pointing it out that, look at this. This exam was $210 and the medical carrier paid $210. what exam in dental pays $210? They're all of a sudden like, well, can we charge more? Absolutely, you can charge more for that level of eval. So it's just, having the courage to step outside the box too, and charge like you are a medical specialist, because we are. So, you look at increasing case acceptance, people moving forward, because even a single plant, a single tooth implant and graft and final fixed prosthesis is probably $6,000. How many of those don't move forward because they can't afford it? A lot of people are walking around with infection in their mouth. And that's the other thing. You were talking about new patients in the beginning of the year. How many new patients or what's our goal for the year for new patients? How many new patients could you see that don't have dental benefits that you could see with their medical benefits and evaluate them, wow them with your practice and your knowledge, and get them going down the right path and getting clear of infection and being able to submit some of that to medical. So there's just lots of great opportunities for medical billing in a practice.
How do we get started? I would imagine that different practices are just, they operate differently. Me as a specialist versus, say, a pediatric dentist or a surgeon, you offer something that's so profoundly awesome and really no risk for us. So can you talk about how do we get started with this?
Sure. What I usually do for practices and doctors is I do what we call an MBA, or a medical billing analysis. You send me your reports of your procedures for the last year. I analyze what you're mainly getting paid, what potentially you could get paid, what you're missing out on, your case acceptance. And I kind of come up with a calculator of, this is what patients are already paying out of pocket, but could have, and I know have medical benefits for. So why wouldn't we tap into that for them as a courtesy, just like we do with dental? And here's some of the things maybe we don't charge for that we could be charging for if we had a way to get it paid for the patient. Here are the areas of patients aren't moving forward with treatment because of the expense. What are we leaving on the table with patients that are not, either things that we're giving away for free because we feel bad? I understand that. We love our patients. They're like family, and we don't want to charge them for something their dental insurance isn't going to cover. I understand that. But what is it that we're not capturing in our practices, and what are the opportunities from that based on the provider's philosophy? Then we come up with a plan. We set goals around that. Every practice is a little different. And, I don't want anybody to feel uncomfortable, like they have to go to an exorbitant amount of a fee schedule that they don't feel comfortable with. You have to feel comfortable with asking your patient to pay for these services. So, but, again, usually practices, once we get going and they start seeing those EOBs come in, and I'm coaching them and showing them the opportunities, they quickly start to see that, and they quickly start to want to reevaluate their fees.
Yeah, I think that there's a lot of dentists right now that are dying to get out of some of the plans that they are currently affiliated with. So this sounds like kind of a win-win adjunct to bring into your practice to potentially compensate for those you might lose, or as an added service to get reimbursement for those that aren't covered, with their dental plan. So yeah. Kendra, this has been awesome. How can people get in touch with you and find out if they are the right fit for this?
They can certainly look at my website, which is tipsmedicalbilling.com. On the contact page, they can reach out to me that way. As well as if you go to the resource pages, there's lots of the videos that we've done and others that they can, just get a feel for this and help shift our mindset as we watch those videos. They can reach out to me via email, which is Kendra@tipsmedicalbilling.com, or feel free to text me if that's easier, 612-418-7870. And I'd love to be able to do a medical billing analysis for you and find out what's the best fit for you and your practice.
Wow. Well, thank you so much. I know you've given me a lot to think about, so I'm sure many of you guys out there are starting to think, all right, maybe this is something we could and should bring into our practices. So Kendra, thank you. I appreciate your time and your expertise and your encouragement for us to level up our practices.
Thank you so much.
Okay, everybody, for DE Business Lab, I'm Dr. Pam Maragliano Muniz, and I'll see you next time.